Welcome, everybody, and thank you so much for joining us today for the Hepatoblastoma webinar in honor of Rare Disease Day 2026. My name is Nicole Nunez, and I'm the Associate Director of Regulatory Affairs and Patient Engagement at Eureka Therapeutics, and I'll be your host for today. Today, we are honored to be joined by Sarah Lansing, where I would like to take a moment to honor her incredible background in the patient and advocacy space. Not only does she have a background in early childhood education, but she also serves as the Director of Communications and Engagement at the Hepatoblastoma Resource Network. She is a member of the Society of Pediatric Liver Transplantation Patient, Family, and Engaged Partners, a member of the Starzl Network Patient and Family Voice, a transplant research collaborative, serves in the Patient Family Advisory Group for the UCSF Pediatric Liver Center of Excellence, as well as volunteers her time annually to raise funds for the Make-A-Wish Foundation through their Trailblaze Challenge. And of course, she is a fierce and passionate parent advocate in the fight against hepatoblastoma. Today, we will be discussing Sarah's family's direct experience with hepatoblastoma, from diagnosis to treatment and what life looks like today. With that, I'd like to welcome Sarah. Welcome.
Thank you so much for having me. I'm really excited to be here.
Thank you, Sarah. Thank you. Just a reminder for everybody, some quick logistics. Please feel free to put your questions in the Q&A section of the webinar on your screen, and we will get to them at the end of the webinar. All right, with that, let's go ahead and dive in. So what I'd like to first talk about is, let's go over what diagnosis in the early days looked like for you and your family. Take us back to when your son, Glenn, was first diagnosed. Tell us a little bit about how old was he, what tests led to his diagnosis, and really just what were those first few days like for your family?
Sure, yeah. So Glenn was 2.5 when he was diagnosed. If you Google hepatoblastoma symptoms, it typically says things like swollen belly, nausea or vomiting, or jaundice, yellowing of the skin or eyes. And Glenn did not have any of those symptoms. It started with a fever and a stomach ache. And this was in 2021. So I thought initially that he might have COVID. And so after calling the advice nurse, I decided not to take him in to be seen at that point. But then what happened was he had really severe abdominal pain, like did not want anyone to come near or touch his tummy. And so after I had another virtual visit with a clinician, so I decided at that point that we should take him into the ER to be seen. But by that point, when they triaged him, I had given him Tylenol for a fever reducer. And so he didn't even have a fever when we got to the ER. We had to wait for 6 hours to be seen. And then they thought maybe he might have a UTI or something going on with his bowel. Ultimately, I took him to a different, a pediatric specific ER at that point. And it was like 11 o'clock at night. And so when we got there, they really immediately triaged him and got him right in to have an ultrasound on his abdomen, which that was where the tumor was seen. And so they essentially at that point told us it was almost certainly liver cancer. And then there were some follow-up tests that were done to sort of like verify the diagnosis. But I mean, it's a parent's worst nightmare hearing that your child has cancer. It was so scary. And then after the confirmation of the diagnosis, everything moved very quickly to get him established as a patient, and we did not leave the hospital. So we were admitted for, I think, 9 days, that first inpatient stay, in which he had an MRI, a biopsy, he had his chemoport placement surgery, he had begun chemotherapy treatment, all within that first hospital stay. So as you can imagine, it was really rough. He was in a lot of pain. He had, what they call white coat syndrome, which meant he was very leery of medical staff because there were a lot of doctors, a lot of people in the room. And they all kind of wanted to touch the part on his body that was hurting him the most. So as you can imagine, yeah. So when people say that childhood cancer affects the whole family, it's absolutely true. As I mentioned, it was still in the pandemic, so there were serious limitations on who could even visit in the hospital. We also have another child, Jack, and he was a baby. He was 7 months old at Glenn's time of diagnosis. So that on a family level, that was the first time that all four of us, myself, my husband, and our two children, were not all under one roof for that amount of time.
Oh my gosh. I just can't believe just how quickly, especially the fact that you go in there thinking it's one thing, it's COVID or some, maybe another run-of-the-mill childhood illness, and just it sounds like, based on that recap, that literally like in 24 hours you went walking in there with one thought and just having like your world just totally flipped upside down. Sarah,
Yeah.
I can only imagine what that's like for a mother to experience that kind of earth changing just understanding of what's going on with your child. Did you have when you were going into the hospital, when you were like maybe Googling symptoms or trying to kind of get to the bottom, did at any point did you come across anything that said something about liver cancer, hepatoblastoma, or was that like
No.
that wasn't even on the list?
No, and that I mean they thought maybe there was something like going on with his bowel, or sometimes toddlers have something called telescoping bowel, so that's kind of what they were checking for. There was no indication. It was totally out of left field.
Oh my gosh. And so now like kind of following up with the story. So here you guys are inpatient. You guys are there for 9 days. You guys are already starting treatment. Can you tell us a little bit about when they first presented treatment options to you, and chemotherapy was one of those options? What was your did they present to you a variety of treatment options, or really were they like chemotherapy is the only option right now? How was it like presented to you to
Yeah.
make the decision?
Yeah, that's a great question. It was pretty much chemotherapy was kind of like the thing that was presented as to be the course of treatment. And with solid tumor cancers, in hand is also surgery to remove the tumor. So we were talking about surgery pretty early on. But as far as systemic treatment, it was chemotherapy. And he was enrolled in a children's oncology group study. And initially, I mean, I had no, at that point in time in my life, I hardly knew anything about chemotherapy, and even less about like pediatric chemo protocols.
Yeah.
So I knew that, so essentially what we were told was that he would be given cisplatin, which is a pretty commonly used chemotherapy agent for solid tumor cancers. Now I know, but we were told that we were to expect, some of the side effects that you would typically associate, I think, stereotypically with most types of chemos, sickness, appetite issues, hair loss. He was also given a baseline hearing test because we were told that he might have some changes to his hearing. But I did not at that point, it's a whirlwind. There's so much going on. There's so many things kind of coming at you. I didn't really research other types of, even other types of chemotherapy protocols. So essentially, he was only given cisplatin. And what I know now, after like years of experience and doing my own research, is that cisplatin is widely used in conjunction with other chemotherapy agents. But initially, that was the only thing he was given.
Wow. And did when they also during those first 9 days, did they also let you know what the staging was of the hepatoblastoma, like whether it was widespread or well controlled?
Right. Yeah. So there's like a couple of different, so again, remember this is 2021.
Yeah.
So the sort of traditional or what is commonly known as kind of the staging of numbers, so stages like 1 through 4, he was put at a stage 3. And so, but now also, given what I know now, he there was some discussion of like a pretext category, which is now more widely used as the common model for staging for hepatoblastoma patients.
Okay. I see. So they got the staging and then they were able to start treatment. And how did Glenn respond to chemotherapy? What, physically, also emotionally, because like you said, they go over what to, potentially expect. How was that? What was it like for Glenn? What was his reality when he was undergoing cisplatin treatment?
Well, so the first thing that they told us was that he was going to lose his hair, and he did not lose his hair on cisplatin.
Wow.
So some of the and he was still a 2-year-old, and so he did have changes to his appetite. He really only wanted to eat barbecue chips for a period of time. That was his go-to flavor profile. But yeah, I mean, so he was 2, and so again he had a really limited understanding of what was happening to him and why. And we did the best that we could to explain things to him in an informational way, but we did keep things pretty basic. But one of the hardest parts for him was needle pokes. As you can imagine, I mean, it's tough for some adults to be poked by needles. And so, that was really hard for us to guide him through. And then, going from once he had his port, then a port
Yeah.
access, which is essentially, if viewers out there don't know what a chemo port is, it goes under your skin, usually in your kind of pectoral area, and that's where the needle goes in. So to then put in chemo into the body, and so it's not just having a needle poke, but it's like somewhere on your body that is kind of like
Yeah.
vulnerable, right?
Yeah.
So those were hard. And then in terms of like how, sort of it affected our kind of all of us, right? As I said, childhood cancer affects everyone in the family. Those cisplatin infusions, because of the nature of some of the immediate side effects, specifically like potential kidney damage, those infusions require an overnight hospital stay. So it's not just going into a lab for like an hour and then coming home. He and I, every 2 weeks, we would pack our bags. And that also meant finding care for, as I
Yeah.
mentioned, my 7-month-old baby at the time, so that my husband, Michael, could keep working to support our family. And, another aspect of chemo is that chemo, sorry, for lack of a better word, P, is
Yeah.
toxic. And so
Yeah.
when you have a toddler who's potty training and is still in pull-ups,
Yep.
there are a ton of specific considerations that needed to be taken into account. Sheets and clothes have to be washed separately. You have to use gloves for diaper changes. And my children could not take a bath together. And I was still breastfeeding my youngest son at the time. And so I had to be extremely extra careful for that consideration.
I can just only imagine just how that just totally changes what your day-to-day life looks like. Like you said, like having to, you're navigating just like the physical and emotional of what your son's going through. And then also, like you said, just the reverberations from treatment and all the precautions and everything extra that you have to do and how much that weighs on you because, obviously you're at the time, like you're having to navigate just normal daily life because life doesn't stop. And then at the same time, you suddenly have all of these extra steps that are piled on, extra hospital visits, overnight stays, and it just radically changes everything in what your day-to-day life looks like. So now, now that we've kind of walked through Glenn's diagnosis all the way through him getting, his first rounds of chemotherapy, cisplatin, um, can you tell us kind of what was next? So now, now the doctor's saying, okay, he's on cisplatin. Did they present any other additional treatment options to you? For example, did they start mentioning doing some type of surgery? And how did you guys navigate those decisions and what was presented to you at that time?
Yeah, so the surgery discussion was really back and forth
Okay.
in those early chemotherapy rounds. Essentially, they wanted to use chemotherapy to shrink the tumor small enough so that they would be able to do a resection surgery.
Okay.
And so every round of chemotherapy, we would then have another round of imaging to then discuss with the surgical team to decide whether or not if it was surgically viable for a resection alone. And, liver transplantation was kind of casually discussed early on, even
Okay.
sort of before his resection. But it wasn't really like, even though it was brought up as something that might be a potential or a possibility, it was kind of like, you know, it wasn't really, transplant wasn't really sort of put out there as the option.
Yeah.
It was first, obviously, like get it to resection. And he also had like a chemo embolization procedure where essentially they go in through the femoral artery in your leg and then put sort of little targeted beads of chemo right around the tumor site. So that was the step that we kind of took. Like, cisplatin really wasn't shrinking the tumor to the surgeon's like expectations.
Yeah.
And so we tried the chemoembolization procedure to try and see if that would make a difference. And it also didn't really do kind of what they anticipated that it was going to do. So yeah, I
Yeah.
mean, we were kind of in this. We didn't really have any sort of other alternative options for treatment presented to us at that time.
And may I ask, while they were just kind of bringing up transplant initially, obviously they wanted to see if they could go forward with resection first. Did they go ahead and list going for a transplant, or were they going to wait until they saw what happened with resection before they went forward with listing him?
So I had actually asked for a second opinion from a transplant hospital on his sort of resectability,
Mhm.
and I was kind of I was actually brushed off sort of by a doctor who essentially said, if you ask a transplant facility to look at a case for resection, they're automatically just going to want to transplant, which now I absolutely know is untrue. But so the process, the way in which it happened, the first time we traveled down to California, because we don't live in California, we went down on a transplant referral, but they wouldn't list him until we got him down there and established as a patient. But actually that ended up being his resection surgery. So once we got down, initially we went to Stanford. So once we got down to Stanford, they did some more sort of in-depth imaging, and that surgeon decided that he could resect, and that was what we did.
And can you walk us through that jump a little bit? Because up to this point, it sounds like when you guys were initially receiving like chemotherapy and going through treatment, everything, you guys were at a hospital closer to your home
Right.
in the Pacific Northwest. So what was it, the doctors that referred you to Stanford, or was that like, so how did that transfer work, especially
Yeah.
navigating insurance and finding that hospital?
Right. So our hospital, the closest one that we live to up here, has a partnership. Some institutions have partnerships with transplant centers, and so that that was sort of that relationship was made through the oncology department at our home hospital, essentially, and and insurance was kind of all encompassed in that because
Oh,
they
good.
had a partnership. We were kind of just like streamlined to that center.
Oh, and can I ask also, so how did you feel about this train? Like, were you, especially, Stanford, sometimes when we hear these big hospital names, obviously it comes with a lot of challenges of having to relocate temporarily to, undergo all the treatment, but were you relieved to hear that they were referring you over to Stanford? Like, what was your thoughts on the transfer itself?
Yeah. I mean, Stanford is a really well-established institution, and they have been doing pediatric liver transplantation for a substantial amount of time. And so I think in that way, it was comforting to some extent.
So now at Stanford, so they performed the resection, and now, after that resection, like what was unfolding at that point? Were they doing more imaging tests, and were they not seeing what they were hoping to see? What happened after that?
Yeah, so he had his resection surgery, and we were told at the time there were clear surgical margins.
Okay.
And so something that is monitored very closely throughout the course of a liver cancer diagnosis is an AFP level, so alpha 1 fetoprotein, which is essentially your tumor markers in the setting of a diagnosis like hepatoblastoma. And so they were monitoring his AFP levels, which after resection surgery, those levels should be cutting in half every so often. Basically there's a half-life of that
Yeah.
in your bloodstream. And so they were starting to come down post resection, and we came home, and then it was missed on one of his lab checks. They did not draw an AFP. And so then I coincidentally was meeting with, I was put into contact with an oncologist at a different institution for the option of genetic sequencing to determine what the best route for his sort of cleanup chemo post resection was supposed to be. And I remember so vividly in that call in real time, this doctor told me that Glenn's tumor markers were not diminishing in half as they should have been, but instead they were increasing, and they were increasing at an exponential rate.
Oh,
So then things moved even more quickly.
okay.
So like than they did at initial diagnosis. So that now this was a case where there was not enough of his native liver remaining to do any type of surgery. So transplant really became our only option at that time.
And so, just to kind of give everyone a frame of reference, at this point, how much time has elapsed since Glenn was first diagnosed to this point where you guys, that a resection was performed? They're not seeing the drop in AFP, they're not seeing what they want to see on the imaging. About how much time has gone by at this point?
Yeah, so he was initially diagnosed in August of 2021, and then had his resection surgery in late November. So a few months after initial diagnosis, and then ended up having his transplant in February. He actually just celebrated his transplant anniversary just a few days ago.
Oh my gosh, amazing, amazing to hear. Okay, so so here he's got listed for a transplant. And now during this time, about how long did you guys have to wait before you where you were listed on the transplant recipient list before until you actually received the transplant?
Um, so, I mean, there was so much to do during that period of time, because we had changed his chemotherapy regimen based on the genetic sequencing that I mentioned
Yeah.
with that other oncologist. And so we were preparing for travel logistics. As I mentioned, typically a transplant center will not officially list a recipient until they're sort of established their care with that transplant team. So we flew to California. We had many intake appointments to get established with his new care team at UCSF. And then, during that time before we left, he was still receiving chemo. And so his new regimen was essentially daily infusions for a period of time. So we were still going to the hospital every single day and preparing to go down to UCSF. But the way in which he sort of his path to transplant, so the liver is one of two organs where you can have a living donor. And so while we were pursuing the sort of traditional, what you think of as being listed on the transplant recipient list, we were going that route, but we were also going the route of determining whether or not a live living liver donor would be viable for him. So my husband is his blood type match. And so Michael was being worked up as his living donor. So he also had a slew of appointments and tests. And ultimately, in collaboration with all of the people on his care team at UCSF, we really determined that we would decide to go the route that got him the liver into his body the fastest. So whichever route could get to him the fastest, that was the route that we were going to take. And so, coming up to the sort of the call, as they say, Michael had done every test. They were really just looking at his information, and the day before they were going to decide whether or not they would proceed as him being Glenn's living donor, we got a call that there was a deceased donor match for Glenn, and so we took that. And so, and oddly enough, I vividly remember that the night that we got the call, we were just about to put Glenn to bed for the night. And then his nurse practitioner, shout out to Lisa, she called us and told us that there was a match, and that he would be admitted to the hospital that night. And so we got him out of bed, we got ourselves packed and ready. But then they didn't actually have the bed available at the hospital for like a little period of time. So we were kind of just sitting on the couch, just sort of waiting, and kind of twiddling our thumbs. But yeah, so from getting down to San Francisco to the day of this transplant was about, I think it was exactly 2 weeks. So again, when you think of people who are waiting on the transplant list for a kidney and they're receiving dialysis, and you hear some statistics and numbers about people waiting for years and years on a transplant list. This was not that case. And he was listed he was listed in the sort of second most sort of severe or priority. You could say he was listed as a status 1B, and there's only one tier higher than that, and that's a status 1A. And I kind of was told anecdotally that children who are listed as a status 1A will not survive a week without the liver transplant. So, and he was just below that. So you can imagine the critical nature of the timing at that point.
Oh my gosh, I can only feel, I feel just that, I mean, I'm so thankful that they were able to move so quickly, and that, one, you guys had a backup option, you had a family member that was a match, and then at the same time, you guys were exploring all other routes to make sure that he got this transplant as soon as possible. Now, he has the transplant surgery. What is life looking like right after that he has this transplant? How obviously, I mean, that is a big surgery. So what was his recovery like? How long were you guys in the hospital? Can you walk us through that a little bit?
Absolutely. Yeah. And so, remembering that he also was basically just on the heels 2.5 months post another major surgery. So due to the nature of his case, nothing was really simple or straightforward. His anatomy was already kind of surgically compromised from that resection surgery. And the transplant centers, will give sort of guidance on timeline of expected, how long you'll be expected to be sort of in the intensive care unit, how long you'll kind of expect to be in the hospital before discharge, how long you should plan to stay local to the transplant facility. And Glenn was on his own timeline. He far surpassed any of those sort of timeframes of guidance that were given to us. Like I said, they say to sort of budget 2 to 3 months, but we were there for almost 6 months. And yeah, that was hard. We did not pack for 6 months. We did not pack for July in California. I didn't even pack a pair of shorts in my suitcase. So, as humans, we like to put things in these tiny little neat boxes, like, okay, we will be here for this amount of days, and then we'll move on and we'll be here for this amount of days. So that was challenging to just kind of have the unknown of like, well, it takes as long as it's going to take. And he had a lot of complications following transplant. And so, everything was sort of every step of the way was sort of delayed, so to speak, as to what we were kind of anticipating to expect. Yeah. And just budgeting, being out of state, away from your extended family for that amount of time. That was the longest that, we had been away from our families. And initially, we decided to leave Jack in the care of our family. So we were away from him for 46 days of the initial transplant stay. That part was brutal.
I was just going to ask because, thinking about this, like having to be there for 6 months, like you said, I mean, you have a little baby also that, you're juggling both of these, top priorities in your life, and, trying to save, one child's life while at the same time, take care of another child's life or make sure that they, have proper care and everything. And I'm just, I can't believe just the long road that you had, Sarah, and that Glenn and your whole family had to go through, just to get to this point, just to get to a treatment option that, is hopefully at this point is looking like a cure, at this point in the timeline. So, okay, so now, you're about 6 months out. They finally clear you to go back home. Can you walk us through now, like what did life look like?
Yeah, I mean, the transition of care from a transplant facility to, your providers at home takes a lot of logistical coordination. There were a lot of phone calls. There were a lot of appointments then once we got home to get him established with who would be his providers, who would be like the continuity of care for him.
Yeah.
And uh, yeah, I mean, it was still a lot, even though, we were sort of past treatment, past transplant at that point. There was still a lot of considerations, a lot of like time and energy and effort put into his care.
Yeah. And so, now once you guys kind of got reestablished, what was it like for Glenn, like after being in the hospital? It sounds like at this point, almost like the better part of a year, once you guys are actually back home post-transplant and everything. what was it like for him and, his development? Obviously, he's 3 now at that point. And so, and obviously there's just so many critical, milestones that happen between like birth and 5 years old. So, what did you see any changes in him? Did you see any changes in his development, especially your experiences as with childhood education? I'm just curious, like what did that look like compared to what you would typically see for other children, especially for a child who had to spend so long in the hospital?
Yeah, well, so a lot of, we think about transplant care sort of being one thing that is sort of lifelong care for recipients, but really, once you move into that post-treatment phase for cancer survivors, it is also it comes with really lifelong considerations. And so the main thing that we then could deal with because we had the time and space and bandwidth was his hearing loss from cisplatin. And so, something that so we got him fitted for hearing aids. We got his hearing continually tested and monitored. And then, what I know from, again, as you mentioned, my background in early childhood education is that, the county and school districts have services that they are able to provide. And so we got established with the county, and he qualified for early childhood special education through our school district in order to have him meet with and set goals for around his hearing loss.
Wow. And I'd like to now also just kind of jump forward, now we're a couple years forward out all the way out to today. I had the pleasure of meeting Glenn last year at the Hepatoblastoma conference that was held in San Francisco, and he's just an incredibly bright young man and just passionate about science. And so, can you tell us just a little bit about what Glenn's life looks like today, and what is kind of like your normal now?
Yeah, I mean, he's still monitored pretty closely by his transplant team. We also still have a ton of other subspecialties that he has seen by besides oncology, hematology, endocrinology, interventional radiology, audiology for his hearing, as I mentioned, dermatology, physical therapy. He still goes to get regular blood draws, but all of those things are much more spread out. So
Okay.
They're pretty infrequent compared
Okay.
to, the active treatment or acute transplant period. If you met him, if you saw him at the park or in school, you would likely not be able to guess the medical journey that he's been through. He loves
Wow.
school. He played soccer this past fall. He took swimming lessons over the summer. He loves riding his bike, playing Lego, video games. I still have to tell him to clean his room, do his chores, not to
Yeah.
roughhouse with his little brother.
Yeah.
Pretty typical 7-year-old behavior.
Ah, well, that's amazing to hear, and I'm just so glad just that he's thriving, and yes, it's coming with still these ongoing appointments, but that, like you said, that they're spaced out a little bit more so that he can enjoy his childhood. And just it's just amazing, Sarah, everything that you did for Glenn to get him to where he is today. Because I know, yes, of course, there's the doctors, there's the care team, but I always feel that the parents, mom, you're the one that's fighting every single battle right there with your son. So just kudos to you for everything that you've gone through, and what you had to do to save your son's life. So
Thank you.
I'd like just to take a moment now, just to ask, based on everything that you've gone through, we have a lot of people on the call that have probably been touched by hepatoblastoma in one way or another. Um, if you had to like leave some lasting advice with everybody on the call, like what would you say to them, if whether they're starting their journey, whether they're post transplant, like feel free, like anywhere in this, what would you like to say to everybody on the call?
Yeah, When I began down this road, I had no idea how to advocate. I wish I would have had somebody to talk to that had been through this already. In honor of Rare Disease Day, hepatoblastoma is exceedingly rare, and it can be really isolating. So if you are a family who is recently diagnosed, I would just encourage you to find the community, because we are out there. We might not be in your same city, but the internet does a lovely way of connecting communities across the world. And so, I would encourage that. I would also, from a treatment side, read, research, do the legwork, because again, if you are not in the hands of an oncologist that has expertise in hepatoblastoma, I would encourage you to seek out the experts.
Yes.
Again, they might not be in your city, but with the nature of the rarity of this type of disease, this type of cancer, you should be in the hands of somebody who has highly specific expertise in this area. And if I were going to give advice to my past self, because I have a fair bit of imposter syndrome, and I call myself a recovering people pleaser. As a parent, I would have told myself that the medical experts are only one piece of your child's care team, and they are human too, and they're not above imperfection, and they're incredibly important, but so are you. And you may not be an expert in their field, but you are an expert in your child. So you should trust your gut and follow your intuition. If something feels off, don't ignore that. They are seeing multiple cases at a time, and you are only seeing your child's case. You know the details. And yeah, utilize the resources that are available to you now. And even if it's something does not necessarily pertain to you in this moment, like write it down, keep a journal, keep a log, keep a binder, whatever system works for you, and be willing to ask for those resources that you might need in the future. So, ask for Child Life, ask for your social worker, find those resources. And connect in any way you can.
Thank you. I think those were all amazing points to touch on. I know so many people who, when they're starting out this journey that we've spoken to, they feel very similar to what you just said. I mean, it really does depend on where you are at and what type of healthcare facilities you have access to, and just because somebody, you meet a general oncologist, if they haven't treated specifically a pediatric patient with hepatoblastoma, I very much think that it's a good idea to reach out and try to find somebody who does have that direct experience. And then to that point, as you mentioned, there's many resources out there. I highly encourage everyone on the call to check out the Hepatoblastoma Resource Network. As we mentioned before, Sarah is very much an active member and is director of the communications and engagement there. And so please make sure to check out their resources. They have a Facebook group that's solely for focusing on hepatoblastoma discussions. They have all kinds of resources. They help coordinate a conference that happens about every other year, where patients and families, doctors, and experts all around this field can get together to learn more. What are the options out there? I'd like to also take a moment to talk about a clinical trial that is currently available to pediatric patients who are battling hepatoblastoma. This is the ARIA-2 clinical trial. It's currently in phase 1, phase 2, and we have active sites currently at Dana-Farber in Boston, Massachusetts, UCSF in San Francisco, California, as well as CHLA in Los Angeles, California. And for this trial, pediatric patients need to meet some criteria, including being AFP positive, having that biomarker we were talking about earlier, that's very commonly associated with hepatoblastoma. So if anyone on the call is interested in learning more, please feel free to reach out to us. Our contact website is www.eurekaconnectme.com. Well, with that, I would just like to take a moment again just to say thank you, Sarah, for sharing Glenn's story and telling us like what his life looks like today. And it's just incredible what you went through, and to hear that he is a thriving child that's just, enjoying life. And yes, some parts of life might look a little bit different, but the fact that he is just doing so well and you guys are back home, and I'm just so happy to hear that. And I really think that your story today is going to resonate with a lot of people who are going through this, who are looking for hope, who are looking for connection, and just wanting to know what this road looks like, especially if they're just starting out. Because yes, everyone's journey is going to be a little different and unique in terms of their path, but connecting with those who've gone through it is so important. So thank you, Sarah.
You're welcome. Thank you so much for having me.
All right. Well, thank you, everybody. We'll be sharing a recording of this webinar within the next couple of days. I just appreciate you all being here today to have this conversation. And until next time, take care.